Welcome to the Prostate Health Channel. If this is your first time here, we're truly glad you've joined us. This channel is dedicated to sharing trusted, science-based information to help men take better care of their prostate health and overall well-being. Whether you're here out of curiosity, concern, or simply a desire to learn more about your body as you age, you're in the right place. One of the most common questions men ask during prostate checkups is, if I have an enlarged prostate, does that mean I have prostate cancer? Or does it mean I'm more likely to get it in the future? These are valid concerns, and today we're going to break this topic down step by step so you can fully understand the difference and know what to do about it. Let's start with the basics. The prostate is a small gland that's part of the male reproductive system. It's usually described as being about the size of a walnut. Its main function is to produce seminal fluid, the liquid that mixes with sperm to support and nourish it. This fluid helps sperm survive the journey through the female reproductive tract, making the prostate an essential part of fertility. The prostate is located deep in the pelvis, just below the bladder and in front of the rectum. It surrounds the urethra, the tube that carries urine from the bladder out through the penis. This positioning is important because as the prostate grows, it can begin to compress the urethra and cause changes in urination. As men get older, the prostate naturally tends to grow. This condition is called benign prostatic hyperplasia, or BPH. It's not cancer, and it doesn't automatically lead to cancer, but it can cause uncomfortable or disruptive urinary symptoms. Let's imagine your prostate like a donut, and the urethra is the hole in the middle. As you age, the donut gets bigger, and the hole gets tighter. This can lead to a weaker or slower urine stream, difficulty starting or stopping urination, dribbling after urinating, a feeling that the bladder hasn't completely emptied, an urgent need to urinate, especially at night. In more severe cases, urinary retention or incontinence. These are classic signs of BPH. Now, while they're not typically dangerous, they can affect your quality of life from interrupting your sleep to making daily routines more stressful. Now here's where the confusion often comes in. Prostate cancer is also a common condition as men age, especially after age 50. But unlike BPH, prostate cancer usually develops in the outer part of the gland, not the center. That means it doesn't always interfere with urination in the early stages. In fact, most men diagnosed with prostate cancer don't experience obvious urinary symptoms at all. Instead, it's often discovered through a PSA blood test, prostate-specific antigen, a digital rectal exam, or an MRI scan done for screening purposes. However, when prostate cancer grows larger or more advanced, it can begin to compress the urethra just like BPH does. This can cause similar symptoms: slower flow, urgency, frequency, and sometimes even blood in the urine or semen. But, in many cases, the signs are silent. So here's the key point. Not all urinary symptoms mean cancer, and not all prostate cancers cause urinary symptoms. That's why screening and medical evaluation are so important. Now, can a man have both BPH and prostate cancer at the same time? Absolutely yes. In fact, it's not uncommon. As men age, both conditions become more likely, so they can coexist. That's why health professionals must assess each case carefully to distinguish between them. Let's talk about the tools used to make this distinction. The first is the PSA test. While PSA levels tend to rise with prostate cancer, they can also rise with benign enlargement, infection, or even after certain activities like cycling or ejaculation. That's why a high PSA alone doesn't confirm cancer, but it does warrant further investigation. Next is the prostate exam, which helps assess the size and texture of the gland. If it feels unusually hard or has irregularities, that might be a sign of cancer. If it simply feels enlarged but smooth, that may point more toward BPH. When there's uncertainty, a prostate MRI is often recommended. MRI imaging gives a detailed view of the prostate and can reveal suspicious areas that might not be detected by touch or PSA alone. If the MRI shows a concerning spot, the next step is usually a biopsy, where small tissue samples are taken and analyzed under a microscope to check for cancer cells. This step-by-step approach allows healthcare providers to make a more accurate diagnosis and recommend the right treatment based on each man's unique condition. As for BPH, treatment depends on how much the symptoms bother you and how much they interfere with your life. Some men do fine with lifestyle changes, such as reducing caffeine and alcohol or not drinking fluids right before bed. Others may benefit from medications that relax the muscles of the prostate or shrink its size, and in more severe cases, minimally invasive procedures or surgery can help relieve the blockage. The good news is both BPH and prostate cancer are manageable, especially when detected early. That's why awareness, regular checkups, and open conversations are so important. Taking action early can preserve your quality of life and help avoid complications. So if you're experiencing urinary symptoms, don't panic, and don't assume it's cancer, but do take it seriously. Talk to a healthcare professional, get the right tests, and be proactive with your health. We hope this video has brought you clarity and useful information. If it has, please give it a thumbs up so we know it helped. Share it with a friend, a brother, or anyone who might benefit, and don't forget to subscribe to the channel so you can stay updated with more content like this. And finally, we'd love to hear from you. Do you have a question? Have you experienced prostate symptoms or undergone a PSA test? Share your story in the comments below. Your experience could be valuable to someone else navigating the same journey. Take care of your health, stay informed, and we'll see you in the next video.